Yes, we want to thank God who has enabled us come this far, and please take time and thank Him for the fact He has brought you. Yes, we had COVID-19, and the fact that you're still alive, you didn't die while others were dying. Please thank Him. And of course, if you had any challenges, yes, count that down. This is a new year, fresh beginning, and focus on to new things. But before we usher you into the new year, why don't we first give you a treat for the new year to guide you on how you will behave? This is HealthPod, and I welcome you to this show. Edrine Mukalazi is my name. And HealthPod is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And we want to thank you so much for having supported us for a full year. Of course, HealthPod will count a full year of enriching your lives. And I believe we are continuing to enrich your lives even in the coming year. But like we had promised you last time, we were with Dr. Geoffrey Musinguzi, and we were talking about cardiovascular diseases. Dr. Musinguzi is with us even today, and Dr. Musinguzi is a research fellow at the School of Public Health, and he's also a public health specialist working in the Department of Disease Control and Environmental Health. He's the person we have today, taking us through cardiovascular diseases. And we understand they carried out some study in Buyukwe and Mukono. So today he's also going to tell us why, of course, they had to take those two districts, Mukono and Buyukwe, and what did they find in their study, of course, on cardiovascular diseases. And I believe by the end of this show, we shall have prepared you for the new year. Doctor, we are delighted to have you even today on HealthPod.
Thank you, Edrine, and I greet you all, our viewers, and I want to wish you a happy new year. We shall follow from where we stopped.
Of course.
The results. Yes. Just finish the risk factors.
Yes, we have not completed the risk factors. We had only talked about hypertension.
Yes, we talked about hypertension and other behavior risk factors.
Yes.
We talked about smoking. We talked about physical inactivity
and the diet,
aspect. Yes,
plus stress.
So yes, plus stress. I want to now move on a little further beyond hypertension.
Yeah.
It is one of the proximal risk factors. There is also diabetes or raised blood sugar. Now, incidentally, like hypertension, this is also increasing in our settings. Instead of hypertension, diabetes, these were considered like diseases for the rich nations.
Yes.
But actually, these are
even here in Uganda, we consider them as diseases for the rich. That is how people term them.
That's a fallacy. That's actually not correct. Yes, yeah, the risk factors. As long as you are within the category of these risk factors, of course, and other exposures, you're actually at risk of these diseases.
Irrespective of how much you have in your pocket.
Exactly. Yeah. So diabetes is also increasing in our community, in our societies, and also in our families. Incidentally, we also never get to know even when you have diabetes unless later in time. So that's the other risk factor that is very important. Also, when you're above 40 years, for example, at least take a screening for diabetes once in a year. Just go and check your blood sugar at least once in a year, above 40. That would actually help you to know. I know in some of the work we've done in Mukono and Buyukwe, where we do a screening of community members, you'll be surprised that actually people come for the first time and they don't know, and then they test
in their lives.
Exactly, and then they test their blood sugar, and then guess what? Their blood sugar is very high, and some of them are immediately initiated almost on treatment. Yeah, so it's important to know that blood sugar is also increasing in our community, in our society, and in us, and it's important to check, but also to consider those other lifestyle factors.
That we talked about last time.
Now, why are these risk factors important? Why change is important? You postponed the risk of developing cardiovascular disease, the risk of developing a heart attack, a heart failure, a stroke. If you try get it maybe at 40, for example, but if you work on your lifestyle, on your health, and you follow these recommended interventions, you'll actually try and contribute to postponing the development of some of these CVDs, the cardiovascular diseases. Yes. And that's the idea. We know the process of developing CVD starts early in life. And slightly asymptomatic, you never get it until you reach the symptom threshold. That's when you start presenting some of the things. I feel this, I feel the other, I feel headache, I feel palpitation, because you reach the symptom threshold. But in reality, the process started much early in life. Yeah. So that's why
you didn't know.
Of course, you didn't know. That's why it's important to start early. Sometimes they meet you and they tell you know what? No, those are for you people who are adult. For you adult, they're not for us who are actually young. So we have to end up living reckless lives, especially when we are still younger, and expose ourselves even faster. We accelerate. Our reaching the symptom threshold, and then you reach there, and you say, oh, I'm 35, I already have hypertension, have the around, yes. So that can be actually postponed, and the family, if we are all cognizant and really, live a health family, purpose to live health in a family, that can help give us health gains. So the other thing which I didn't talk about in the proximal, in the distal risk factor was alcohol consumption.
Yes.
Edrine, I didn't talk about alcohol consumption. Now,
I had it on my list to ask it.
Excessive alcohol consumption is actually not a good idea. So there are three things I recommend. One, if you've never started taking alcohol, just don't take alcohol. The recent studies seem to suggest that actually there's no benefit of any amount of alcohol in our bodies. But also we know some people can't just do without alcohol. So if you cannot really do without alcohol, then take the very minimum. And WHO gives some little recommendation for men about at most 2 units or 2 standard drinks, and then for female at most 1 unit, 1 standard drink.
Per when?
Yes, I mean that is if you really must take a day. If you really must take at least 1 unit, if you really must take. But the moment you go above 3 units, then that's a problem. And I'm using the word.
You're already exposing your body.
Yeah, of course I'm using this in simply because we have all various forms of alcohol in our setting. You have Toads, you have the other, all sorts of those alcohols. Yes, yeah. So I can't really go so much in the details of those alcohols. But if you've never started taking alcohol, just let it go. You'll maintain. But if you are taking and you really must take, then take more than 2 units. That means for example,
is there anything like someone must take alcohol?
The thing is that people take alcohol for pleasure, for fun, for socialization. Those are the motivators of alcohol. You get, yes. But the truth of the matter is that no one says that you really must take alcohol. Isn't it? Yes, yeah. So if you really must take, keep it low. But the best thing would be to keep out from alcohol. I remember the moment you become an excessive alcohol consumer, it becomes very difficult to stop because it becomes addictive.
That's true.
And then you may need the care of the health facility or the medical or the psychiatrist to help, And sometimes you actually need drugs to get you off alcohol. So we have had such cases, of course, there are many common, especially in some of our facilities. So alcohol consumption, if you haven't started, don't start. Or if you're drinking, keep it at the very minimum. Yes, I think that's the message which I wanted to really give regarding alcohol. Now, I've spoken about a number of these. Smoking, I talked about smoking the previous time. I talked about physical inactivity. I've talked about alcohol today. I talked about diet, yes, the other time. I've talked about stress. I've talked about diabetes. I've talked about hypertension. I want to talk about obesity and overweight.
Hey, people always, thank God you're talking about obesity, and people always look at us and they say, okay, they think someone's slim. Maybe they're not feeding well or what. So, now that you're talking about obesity,
So I want to approach it a little bit different. Yeah. So, there is no standard size of a person. You said that I'm the standard person. No. Yes, we measure overweight, obesity, or using what we call a body mass index.
Body mass index.
Yes, a BMI. Yes, or we can do what they call a waist and hip circumference. You get a tape measure. You measure your waist. You also measure your waist circumference. Yeah, but I'll start with the BMI. So that's what they call a normal body mass index. And how does you get a body mass index? You get your weight and your height. Yes, so it's calculated from the weight
and the height.
Yes, and then when you get your BMI, the BMI, normal BMI should not be above 24.9. Above 25 to before 30 is overweight. Above 30 is obesity. And of course also
irrespective of your body size.
Of course, when you say BMI, exactly, yes, yeah. So the BMI above 30 is also graded. The body mass, overweight, obesity is graded. Obesity stage 1, obesity stage 2, and morbid obesity. It's now become really sickness, so to speak, yes, yeah. Now, Physical inactivity will increase your
obesity.
Obesity or overweight. Eating food high in calories will increase your obesity. Of course, high sugary drinks will increase your obesity or overweight, so to speak. Yes, yeah. So the measures to try and control overweight is some of the things I've talked about. Do some physical activity, control your diet that you're actually eating, control your diet, eat in moderation to be able to control overweight. Now,
some people have gone ahead to take pills.
No, it's not really a good idea to really use any of those supplementary supplements really try to remedy. Because the thing is that you always gain health if you do the things that are within you, God has already given you naturally. Yes, because physical activity, God has given you the legs, has given the hands, if you can really run, of course. But even some people, okay, people may be disabled in some form. They could still do some form of activity.
They can do.
Keep your mind psychologically involved in terms of, so that you don't really get. So the other thing I want to talk about is abdominal obesity. Yeah, in our culture, having, that makes us really, we are the rich guys when you really have that.
Of course. So and when you start having it, then people will say, when you start protruding, people will say,
yes. So incidentally, central obesity is associated with a high risk of developing hypertension, diabetes, but also cardiovascular diseases. Yes, yeah. And the other thing is that this storage, you actually always excess fat storage, and you may never make a decision that I'm going to store here or store there, isn't it? Yeah. In most cases, you find that when people start accumulating fat around their abdomen, it's just the body is trying to store, just in case of hunger, isn't it? But when will hunger ever come? Sometimes you're in a severe hunger is not going to come. So it's just prepare storing. So in the process, what you've stored turns out to be a catastrophe for you. So I just want to talk about those. Now, finally, regarding these risk factors, I said they confer synergistic. They confer synergies in terms of increasing the risk of developing cardiovascular disease. For example, a person who is smoking has a 2.9 CV risk of developing cardiovascular disease. A person who has diabetic mellitus has about a 2.4 risk of developing cardiovascular disease. And there is one I didn't talk about, excess lipids. Excess lipid profiles, isn't it? Or fat. Let me just use the word fat.
Yeah, fat.
Excess fats in the body. They are the bad fats. There is the lipoproteins, the bad fats. That you didn't talk about that one. But it's also very an important risk factor. And how do you deal with that? Reduce just a lot of fat consumption. Some of us really eat fat. They put almost oil.
Fat and meat and everything.
Yeah, fat and meat, fat, and of course.
And then the fat and meat is also fried using cooking oil.
Yes, yeah. So try to limit the amount of fat you're taking, and in any case, also move towards healthier fats. Yes, yeah. Some fats are unhealthier, some fats are healthier. Yes, saturated fats are unhealthier, and in most cases, you will always have these fats actually labeled, so to speak.
Well, doctor, let's shortly take a commercial break, and then we shall be right back. Keep your eyes on Chapter Uganda Family TV.
Brethren, yes we can. We can clear the debt of church house, and I want to invite you to give generously to the love gift. May God bless you as you give.
Welcome back from the commercial break. This is Health Pod, brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And here we are. Of course, you who has just joined in, we are looking at cardiovascular diseases. And we are basically looking at the risk factors. And in this session, we're of course going to talk about the results from the Mukono survey. And of course, that will mark the end of 2021 Health Pod. And we shall now hand you over to the new year. So, Dr. Geoffrey Musinguzi, before the commercial break, you were taking us through the percentages, the risk percentages of these various risk factors.
Yes. So what I want to say is that I gave you an example. That,
Yes.
I've talked about smoking, I've talked about high blood pressure,
Yes.
I've talked about diabetic mellitus. So, of course, physical inactivity, psychosocial stress. Now, these risk factors confer synergies. They help each other in increasing the risk. For example, if somebody is overweight, obese, somebody is smoking, somebody has high blood pressure, for example, and then somebody is stressed, their risk of a cardiovascular disease really multiplies so many times. What does that mean? And
then, as that is on the way, diabetes also comes in.
Diabetes may come in, and many other factors that I've talked about. Now, I want to say two things. Any effort to control any of those risk factors will give you some health gains. For example, if somebody has been smoking and they stop smoking, even when they remain overweight, they will gain some health as a result of stopping smoking. If somebody has been physically inactive and then even when they are overweight, Edrine, this is important for you.
Yes.
Just sometimes when we are small-bodied like
hey.
women
brag around.
We are not at risk, isn't it? That's actually not very true, isn't it? Yes. If you're physically inactive, small as you are, isn't it? Your diet is not really very good, you may actually have a very high risk, cardiovascular risk compared to the person you think is actually overweight, isn't it? If they're actually trying to live a good health lifestyle. If they are physically active with their overweight, their diet is controlled, and so many other things, they will actually have more health than you do. So this is a caution for people who think that when you're small, then actually you don't need to do these things. Yes. So that was a caution. So any effort to reduce the risk factors, any of these risk factors I've talked about, is good. If you have hypertension and maybe your doctor recommended you to take antihypertensives or you are on antihypertensive drugs, adhere to treatment, isn't it? Yeah, sometimes they will even when the numbers get back to the normal, they'll always give you some kind of maintenance dose to keep your blood under control, blood pressure under control. Similar diabetes. So if you're on drugs and you're on drugs, make sure you maintain those. Don't get them off unless the doctor tells you now you don't need to take them. Okay. So that's what I wanted to say. If you're physically active, try to put it on routine, put it on your schedule. So any effort to control any of these risk factors will give you health gains. That's the key message which I wanted you to really take today. That so let's integrate multiple responses, multiple efforts, and address the range of risk factors. Salt. Just get rid of that table salt from your table. You actually don't need it, so to speak. Yes. Alcohol consumption, get rid or significantly reduce if you really can't get rid of, and of course you can also get support. Psychosocial stress, if you cannot really manage, you can also seek help from a specialist or from a healthcare provider. So those are the risk factors. So very briefly, I'll take you to Mukono and Uyikwe.
Wow. So Doctor, why among all the districts you chose Mukono and Uyikwe?
Yes, we have been in Mukono and Uyikwe for a while. In 2012, we conducted a fairly large study among a community study in 111 villages in the districts of Mukono and Uyikwe. And during that time, we are interested in understanding the prevalence of high blood pressure. We're also interested in understanding prevalence, the burden of high blood pressure, so to speak. We're also interested in understanding awareness about high blood pressure. Then, of course, we're interested in understanding the control of blood pressure. And then, of course, treatment, towards on treatment. So the range of things, also the capacity of health facilities to actually manage hypertension and to manage hypertension at that level, and also provide other related services. So from that study, which we published in 2001 in PLOS One, we actually realized that the prevalence of hypertension was high, almost one in 23, almost 25%. That's almost 1 in 4. Yeah. 1 in 4%. One in four people had actually what? High blood pressure. That was actually concerning. And then, when we went to the health facilities in the community, I mean in the different health facilities in Mukono and Wikwe, many of them didn't actually have even a blood pressure to measure even the patients who got these facilities. So there were these huge gaps. Drugs were of course also not there, and of course other diagnostic equipment were lacking. There were no blood glucose meters were also lacking at those levels. So from this gap, we realized we needed to intervene. So we started what we call, we wrote an application to the European Commission to respond to the burden of hypertension and broadly cardiovascular diseases in these districts following the gaps we had. And that led us what we call the SPICES project, which means scaling up packages of interventions for cardiovascular disease prevention in Mukono and Wikwe districts in Uganda. Although this study is beyond only Uganda, beyond Mukono and Wikwe, we are also in South Africa, we are in the UK, we are in France, we are also in Belgium, yes. Doing the same thing, talking about these risk factors, measuring risk factors, and also equipping and supporting facilities to be able to measure these risk factors, but also supporting community health workers, because those are the nearest to the community.
Yes.
We have trained some of them, about 80 of them in the districts of Mukono and Wikwe, to be able to sensitize people about the risk factors, as I've just talked about now. But also we have trained healthcare workers at the health facility, 366 in 23 health facilities in Mukono and Wikwe. Any facility you go to, public health facility, Health Center 3, Health Center 4, and the hospitals, you'll be able to at least get a blood pressure measurement in those facilities.
We have like two.
Yes, yeah.
Mukono General Hospital and Kawolo.
Those are hospitals.
Yes, the hospitals,
Yes.
I mean.
Then we have 2 health centers. We have Koja Health Center 4, that's one. And then we have 20 health center 3s.
Okay.
We have equipped all those facilities with basic screening facilities. We gave them what we have. We gave them an inter-heart screening tool to screen for all these range of risk factors I've talked about, in order to characterize the person as high risk, medium risk, or low risk. So we did that, yes, yeah. And then, of course, the only gap we should have to now is really drugs. Yes, I think that's really the core gap we have. But we are still, of course, in discussion with the Ministry of Health to support this area. Yes, yeah. So if you go to Mukono, any of those health facilities, 20 of them, for government health center facilities, you have an opportunity to have your blood pressure checked. Yes, so
free of charge, or they
free
go
of
some
charge,
money?
sure, it's free of charge. Yes, we also equip them with computers, so they also do digital screening for all other risk factors to be able to aggregate the risk of a person developing cardiovascular disease. So some of the results from our earlier study talk about 1 in 4 having hypertension, but we realize that many people, about only 36% in the people we measure, over 4,500 have ever had an opportunity to have their blood pressure measured. That's why I asked you the previous episode, did you ever had your, so only 36 had ever had. So we realized that those are the gaps we needed to fill in, yes. So as I summarize, what are some of the key findings? We have been intervening in Mukono and Wikwe for almost 3 years now through this SPICES project funded by the European Commission. I appreciate the European Commission for that support. Yeah, so we try to see whether we are seeing any changes in some of these risk profiles I've talked about following the interventions at the community and the health facility. So regarding smoking, current smokers, we observed that the prevalence of current smoking was about 6.8 in January 2019, and we repeated the survey in April 2021. This year. The prevalence of smoking was 6.8, and in 2021 it was 6.9. So it did not change. That's why I said that's why they are notorious. So it's very difficult to change. However, we realize that regularity of smoking daily, significantly reduced. In fact, among those who are smoking daily, those ones who were smoking daily, the prevalence, those who have said you are smoking daily, reduced from 77.6 to 66.3, an 11.4% drop in smoking daily. That shows there is an effort to reduce smoking as much as they're not able to go over it. Then passive smoking, people are smoking in their households, with their family members, reduced from 20.4 to 14.4. So that shows that this project has actually made some contributions in those areas. And then of course the other challenging bit which I wanted to report is overweight, and incidentally did just go high from 30.9 to 33.9. Of course you have had COVID, lockdown, and those other modifiers that may actually come into play, because COVID just stuck struck in 2022, and this has been really a rocky year.
2021.
Yeah, these have really been rocky years. Yes, you know, episodes of lockdown, people are home, and then of course the access to quality foods also not possible. So the overweight went high. So as a result, also high blood pressure went up by 1 percentage note, from 23.5 to 24.5. Yes, so that became actually an increase of high blood pressure, which was not really, of course, nice. Then the other concerning one is anxiety and depression. We use there's a Euroqual, it measures the health-related quality of life, and then we assess anxiety and depression. Unfortunately, that also went high from 42.2 to 52.4, over a 10%.
I think it could also be partly because of the lockdown.
It could be many factors, but also CVD, but also COVID-19 may have something to play. So Edrine, those are just a few of the results I want to give you, but I hope this basic knowledge will help community members and the families to have some changes.
So Doctor, as we wind up, what is your last message to our viewers there? And you wish them a happy new year.
Yes, happy new year. Let's embrace good health lifestyles for better health. This is a family program. One of the biggest problems we have, especially in sub-Saharan Africa, is that many people are dying from cardiovascular diseases at a young age. When they are very productive, you know, somebody at 45, a knockdown stroke is gone. They leave young children behind whom they would have otherwise taken care of into more meaningful lives. So these risk factors and mitigations are actually possible, but it takes a determination to embrace them. So that's my last message, Family TV. A happy new year.
Wow, thank you so much, Dr. Geoffrey Musinguzi, and thank you so much, the entire team of the School of Public Health, Makerere University. And I want to thank you as well, you, our audience, who have watched Health Pod from the time we started up to now. And we promise you the best from the production team as for Health Pod. Please keep your eyes always on Church of Uganda Family TV. I wish you a happy, blessed, fantastic new year. Mukalazi is my name. I've worked with Jonah Jal, the producer, Tony Santo on social media, and Bantam in transmission. Enjoy your New Year's Eve.